Time now for Morning Rounds. Joining us are CBS News Chief Medical Correspondent Dr. John LaPook and CBS News contributor Dr. Holly Phillips. First up this week, good news and bad news about diabetes in the U.S. A new federal study says heart attacks and deaths from the disease dropped by more than 60% between 1990 and 2010. John, why are we seeing such improvement here in these numbers?
Well, we're getting better at diagnosing. There's some improved medicines to lower blood sugar, better insulins and oral medications. There's also statins to lower cholesterol and blood pressure medications. That all helps with outcomes, but it doesn't argue against the fact that we're just seeing a huge increase in the number of people who have diabetes.
So then what is the bad news?
That's the bad news. I mean, the bad news is we've almost doubled to about 10% of American adults having diabetes. And of course, that is because of the obesity epidemic, which is just going up like crazy. We're doing well in general in treatment, but this is a preventable illness. We do particularly badly in non-Hispanic blacks and in Mexican Americans. So that's an area where we really have to focus our attention.
Also this week, a new study published in the journal BMJ Quality and Safety says millions of Americans are misdiagnosed by their doctors every year. Holly, that sounds like a big number.
Yeah, I mean, this is actually really kind of alarming numbers when you look at it. If you think about the hundreds of millions of outpatient visits that happen every year, these numbers suggest in about 5% of those visits, patients are actually misdiagnosed. So what that means, in some fields you could say, well, doctors are right 90% of the time, or, you're right 95% of the time. That's great. In medicine, those 5% of all visits resulting in misdiagnosis, that can be life-threatening. And half of the cases, they are life-threatening or have serious complications.
Holly, why is misdiagnosis so common in outpatients?
There are a number of factors. Some of it just has to do with the doctor's fault, right? Misinterpreting lab results or giving incorrect medications. Some of it has to do a little bit with the patients. They might give incomplete or incorrect medical histories. But a lot of it, I just think, has to do with how medicine happens today. Basically, visits are very short. Everyone is crunched for time, in all aspects. And I think that's when mistakes happen.
Is there a way then, John? I mean, it sounds like maybe the answer is no here, but how do you protect yourself as a patient?
Well, I think patients have to be aggressive with their doctors and make sure they're getting the information they need. And they also have to do their own homework. Patients do have responsibility. Beforehand, find out your family history. Come in knowing what medicines you're on. Don't say, it's the little pink pill. And actually, doctors want to know chronologically what's going on. So if you have a bellyache, when did it start? What makes it better? What makes it worse? Have you ever had it before? What's the arc of your symptoms? It's sort of like a Sherlock Holmes thing. Help your doctor to help you, because if you actually tell it the right way, maybe the doctor is going to be able to interpret it better. And also, you need to be aggressive in terms of the interaction with the doctor and the communication. If you don't hear a result of a test, go out and find it. Make sure that you call the office. No news is not necessarily good news. Yeah. So it's all about sort of taking ownership.
It is. I think there is, at this point, we have to have this sort of teamwork between doctors and patients to make sure nothing gets ignored. I agree.
But you need more time, and Holly is absolutely right. Yeah. I had a great professor who said to me, if you let patients talk long enough, they'll actually tell you what's the matter.
That's true.
All right. In Dallas, 9-month-old twin brothers are out of the hospital for the first time in their lives. Emmett and Owen Ezell were born conjoined. They shared a liver and some of their intestines until separation surgery in August. Their parents took the boys to a rehab center this week to continue their recovery.
They're very interactive, very social little boys. They flirt with all the girls that come in. They flash smiles and wave, and they're what they're supposed to be.
I think we can say, all right, this is normal. And even if it's normal with the boys and they've got feeding tubes and trachs, but they're home, that's going to be normal, and that's going to be fantastic.
Oh, that's amazing news. It was a 9-hour operation.
Unbelievable. What a tour de force technologically to be able to do that.
Such great news. Well, 2 studies out this week highlight the long-term dangers of concussions in teen athletes. Canadian researchers say teens who suffer traumatic brain injuries during sports have a much higher risk of suicide attempts. John, it feels like we've heard some of this, but in relation to professional athletes, how are the teens different? Yeah,
we have heard it with professional athletes like Junior Seau, Ray Easterling, and Dave Duerson, who are NFL players who committed suicide. And the fear with kids is, in adolescence, the brain is still developing, and this is a period that's particularly sensitive to trauma. So in this study, they looked at kids 7th to 12th graders, and they found that after they had traumatic brain injury, this was in Ontario, Canada, that they had a higher chance of having behavioral issues, emotional issues, and these included things, not only increased risk of suicide, but they were more likely to damage or steal property. They were more likely to take a car without permission or to sell marijuana, to carry a weapon or to get into a fight. So this is an area that is just now being started to be seriously studied, and I think we're going to hear a lot more about it.
Holly, there's another study this week that said many teens don't get enough downtime in the off season. Tell us about that.
You know, Anthony, this really comes down to the body has this incredible ability to heal itself if you let it. So in this study, they looked at football players right at the end of their playing season, and not surprisingly, many had signs of traumatic brain injury after, taking so many hits to the head. Then they looked at them again 6 months later after their theoretic off season when they weren't playing as vigorously, and many of them still hadn't healed. Those injuries were still there, which makes it more likely that once they get into the playing season, they'll suffer even more serious injuries. So I think a lot of it comes down, and especially for the teens, as John was talking about, the off season needs to be a true off season where you're not playing, you're not practicing, and you're letting your body heal itself.
Finally this week, if you find yourself lashing out at your spouse in the evening, it might be that low blood sugar is to blame. This is a conversation I have with my son about if anger comes from hunger, and it actually happens with adults too, doesn't it?
Very much so. I like this study because it kind of points out that a lot of domestic bickering isn't about actually, you didn't put the toothpaste cap back on the tube. It's much more how you're feeling, right? You're responding just out of feeling irritated or not your best.
It's another good argument for the family dinner, for not having a serious discussion on an empty stomach, or if you're feeling lousy, you should feel good, then have that serious
I appreciated that
dessert.
they used voodoo dolls with pins also.
Let's not even get into that.
Dr. John LaPook, Dr. Holly Phillips, thank you.